During the summer of 2012, I'd been suffering terribly from what my GP suspected was heart disease. I'd been through all the cardiac workouts available, and after an angiogram with a full blood workup, the surgeons informed me to consult my GP for the results. Oh dear, I didn't like the sound of that at all. You have multiple myeloma, the GP said. It's not curable, but it is treatable. I had to have it spelled out for me. I'd never heard of it, and you could have knocked me down with a feather. Multiple myeloma is a type of bone marrow cancer, but it's different from leukemia. It's called multiple myeloma because the myeloma cells can form tumours scattered throughout the skeleton, especially in the spine, pelvis and ribs. This often causes pain, sometimes with bone fractures, and there may also be anemia, a tendency to infections and a risk of kidney problem. 2 weeks later, when I attended the anchor unit for the first time, my heart sank when I walked in and saw the familiar green sign for the Macmillan nurses. Little did I realise I would become a regular visitor. During one of my first visits, I had a bone marrow harvest to confirm the condition. I was terribly anxious as my pain threshold is non-existent, but I had an extremely kind and understanding nurse holding my hand whilst the procedure was carried out. Everything had been fully explained and I was given local anaesthetic to help me tolerate the procedure. After every visit, I was always very aware of the kind and understanding nature of the anchor unit staff. I couldn't believe that on the day my condition was confirmed, I was sent home with a huge bag of medication and an extremely detailed and well-organised timetable of drug taking. To be given my various medications on the same day the condition was confirmed was the last thing I expected. I was then given treatment on a monthly basis, so the anchor unit visits became part of the regular routine. Unfortunately, my system couldn't cope with the initial drug combination, so after a single cycle, I ended up really unwell and in the haematology ward for a week of intravenous antibiotics. I was due to attend the clinic that day and wasn't in a fit state to drive, so Duncan dropped me at the rotunda doors hoping I'd make it up to the patient ward safely. I literally staggered through the anchor unit doors into the welcome arms of one of the nurses. She took me straight through to the examination room and lay me down and covered me with a warmed blanket and reassured me that the dreadful shivering and chattering of the teeth was a typical sign of the infection. Once again, I thank my lucky stars that I was being so well looked after. With the new anchor centre, it will have its own entrance and make it much easier to get in and out, especially when you're feeling unwell. Back to square one. The second treatment consisted of injections on Mondays and Fridays. It had also been agreed that I would go through a stem cell transplant, which would involve many growth factor injections at home in preparation for the stem cell harvest. The growth factors would encourage the sticky stem cells to be released from the bone marrow and into the circulating blood. The blood would then be filtered through the complicated piece of equipment in the blood transfusion department in order for the stem cells to be harvested and frozen. Counting down towards the stem cell harvest time, I was admitted to the orthopaedic ward around May-June for a procedure called OsseoFix. This involved inserting 4 titanium stents into my most badly collapsed vertebrae. This is one of the many complications of The vertebrae are weakened and collapsed, which can be extremely painful, especially when sitting or standing unsupported. The constant downwards compression can become fairly debilitating. The stents provided stability and prevented further collapse. I also attended the orthotic department in Wood End to be fitted with a back brace. This has been a great success and improved my mobility a great deal. During my spell as an inpatient in the old Ward 16, I'd been warned that we could be transferred over a weekend into the new premises in the green zone. I clearly remember the day of the big flit. I had been in the original haematology ward, and on the Sunday we were all due to be transferred to the new wing on the 7th floor to Ward 112. Everything had to go. The place had to be completely empty by the Sunday evening. Beds, patients, equipment, and the machines that go ping. Once again, the anchor staff really pulled out all the stops. All hands on deck as we were transferred still in our beds from the old ward into the new one. And I'm sure when it comes to departments moving the outpatients and day treatments to the new anchor centre, the move will go as smoothly. Unfortunately, the second induction regime wasn't as successful as we'd hoped, and I relapsed during August 2013. This meant the transplant was put on hold until I was treated with a third induction treatment. This was a great success, and I was finally admitted to my isolation room for my stem cell transplant in February 2014. Best case scenario can be 3 weeks, they said, but it could take as long as 6. I was discharged 7 weeks later after strict instructions to take it easy. I received the absolute best care, as I was pretty poorly for most of the time in isolation. During this entire process, which continued from January 2013 until my stem cell transplant in April 2014, the Anchor unit staff were behind me all of the way, providing me with help and advice and the best care imaginable. After my transplant in 2014, I had 4 good years of remission, but unfortunately relapsed in early 2018. I was reassured that things could remain stable for up to 2 years, and that's exactly what happened. Everything remained stable until the beginning of 2020. No sooner had intervention been mentioned when the dreaded coronavirus appeared on the scene. I have been fortunate enough to be able to enter the treatment program again and have been attending the Anchor unit twice weekly since October 2020. My current drug combination wasn't even around during the early days of my treatment, but my goodness, we're so lucky that new treatments are available all the time. Thank goodness for the wonderful nurses and doctors responsible for our care. Where would we be without them? I am delighted for the staff that will have this new building to work in. A million thank yous as always. The Anchor team are simply the best, and I can't thank you enough for all your hard work. Here's to the new Anchor Centre. All the very best, and a million thank yous as always.